Debate, the Honourable Member for Courtenay-Alberni.
Mr. Speaker, this week marks 1 year since the 2021 election, and it's been another difficult year for many, with more uncertainty on the horizon. The impacts of the pandemic continue to be felt in our communities, and our healthcare system is under intense strain, and the rising cost of living is adding stress to the daily lives of Canadians. In the last election, the Liberals made a promise to Canadians that it would take steps to improve access to mental health care here in Canada. That is certainly needed, as polls have shown that about half of Canadians have suffered from worsened mental health since the onset of the pandemic. And unfortunately, too many Canadians are unable to access mental health care when they need it because of long wait lists or financial barriers. We need a national mental health wait time strategy to ensure people can access support in a timely way. And we need to break down the financial barriers that keep people from getting the care they need. A cornerstone of the Liberals' promises on mental health was to establish a new permanent transfer to the provinces and territories to expand publicly funded mental health care and address backlogs. Canadians were told an initial investment of $4.5 billion over 5 years would be made in this country through the Canada Mental Health Transfer by the Liberals, Mr. Speaker. Now, here we are a year later with no idea of when this money will get out the door. When the government announced its intention to establish a $10 a day childcare program, there were deals with all the provinces and the territories in place within a year, Mr. Speaker. Meanwhile, the Canada Mental Health Transfer was nowhere to be found in the 2022 budget, and there's been no transparency on when this much-needed investment will be made. That's why I tabled motion M67 to encourage the government to act without delay in creating this transfer and to take steps needed to ensure mental health is put on an equal footing in our universal public health care system. I'm going to read the text of M67 as it reflects what mental health stakeholders have been telling us and calling for. That the government recognize that, one, Canada is experiencing a mental health and substance use crisis that has been exacerbated by the COVID-19 pandemic. Secondly, that too many Canadians are unable to access mental health or substance use supports in a timely manner. Third, that lack of access to community-based mental health and substance use services increases demands on hospitals, emergency rooms, and primary care providers. And fourth, untreated or inadequately treated mental health carries significant social and economic costs. And B, that in the opinion of the House, the government should first, without delay, develop legislation that will enshrine in law parity between physical and mental health in Canada's universal public health care system and ensure timely access to evidence-based, culturally appropriate, publicly funded mental health and substance use services beyond hospital and physician settings, and recognize the importance of investing in the social determinants of health, mental health promotion, and mental illness prevention, and include national performance standards and accountabilities for mental health and substance use services. And secondly, without delay, establish the Canada Mental Health Transfer to sustainably fund the provision of mental health and substance use services and disperse an initial investment of $4.5 billion to the provinces and territories, and report to Parliament annually on progress towards achieving national performance standards for mental health and substance use services. As we try to recover from COVID-19 pandemic and navigate uncertain economic times, mental health can't wait. So I ask, when will the government follow through on its promises on mental health and deliver help to Canadians who are struggling?
L'Honorable Secretary Parlementaire de la Santé.
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker, and I thank my colleague for the riding of Courtenay-Alberni for this important question and for his advocacy. Thank you for giving me the opportunity to address the House on what we are doing to support the mental health needs of Canadians. We know that this pandemic has had a toll on the mental health of Canadians, due in part to increased isolation, stress, anxiety, depression, and loneliness so many face during the pandemic. Additionally, COVID-19 has pushed an already stressed healthcare system to its limits, and it can be a challenge for Canadians to know where to look for help, to find the right help, and to be able to access that help right away. Right from the start of the pandemic, we have been there for Canadians during these difficult times. We acted right away during the very early days of the pandemic by introducing Wellness Together Canada. The Wellness Together Canada portal has served as an invaluable connection for many Canadians, allowing them to get the help they need even when they could not leave their homes, or use it as a stepping stone to receive advice on where to find more specialized care. Le portail
Canada's Workspace portal is convenient, accessible, and successful. With over 2.7 million users, we know that this portal is helping to meet the needs of Canadians.
Another need that we are addressing is the establishment of a 3-digit suicide prevention hotline. As of next fall, November 30th, 2023, Canadians will have access to an easy-to-remember 988 number to call when they are in need. We also recognize that even more needs to be done. Le transfert.
The Canada Mental Health Transfer will be a new permanent federal transfer to the provinces and territories to help jurisdictions expand the delivery of high-quality, accessible, and free mental health services. Our government is committed to getting this new permanent transfer right, and that is a reason for which Budget 2022 reaffirmed our commitment to work with the provinces and territories to develop the mental health transfer. The Government of Canada also remains committed to funding the MHCT with an initial investment of $4.5 billion over 5 years.
The Minister of Mental Health and Addictions has also undertaken extensive stakeholder outreach to gather views to inform the development of a comprehensive and evidence-based mental health plan. This engagement is ongoing and will also inform the development of the mental health transfer. The mental health transfer will be established with the benefit of the input from the ongoing provincial, territorial, and stakeholder engagement. Notre gouvernement.
Our government has made historic investments in mental health, including $5 billion to the provinces and territories through bilateral agreements, which will provide $600 million annually to support the Joint Statement of Principles of 2017 on Shared Health Priorities, which is currently helping to increase the availability of mental health and addiction supports for Canadians. This existing transfer provides $600 million on an annual basis until 2027. We have also announced our intention to work with the Standards Council of Canada to develop national standards for mental health and addiction services. This to meet the mental health and addiction needs of Canadians. In Budget 2021, we invested $45 million in this initiative.
Member for Courtenay-Alberni.
Mr. Speaker, as I cited earlier, that the government announced its intention to establish the $10 a day childcare program, and there were deals with provinces and territories in place within a year. Here we are a year later when it comes to mental health transfers, and they still haven't delivered their 2021 election promise. Now, too many Canadians can't access appropriate mental health or substance use services in a timely manner, either because they'd be required to pay out of pocket or they face long wait lists for publicly funded care. The average wait time for adult residential treatment for substance use is 100 days. In Ontario, there are more than 28,000 children on waitlists for community-based mental health services that can range from 67 days to more than 2.5 years, Mr. Speaker, depending on the service, exceeding clinically appropriate wait times. This is unacceptable, Mr. Speaker. These are children. I'm calling on the government to be more transparent and move rapidly on their $4.5 billion transfer. It's needed now. Mental health care is needed now.
The Honourable Parliamentary Secretary, thank you, Mr. Speaker. And I have heard my colleague's question. I do agree that the current crisis is too acute and that we must act to meet mental health needs for Canadians. And we've often said mental health is an integral part of health, and our government has made it a priority. Since 2015, we have made historic investments, including $5 billion to provinces and territories to increase access to mental health care, nearly $600 million for a distinctions-based mental health strategy for Indigenous peoples, $140 million to support veterans, $45 million for national mental health standards, and $270 million for the Wellness Space Portal. We also remain committed to the new mental health transfer of $4.5 billion over 5 years.
Establishment of a new permanent Canada mental health transfer is one of our top commitments. The government is fully committed to designing and implementing a new permanent Canada mental health transfer. Thank you.